Welcome back. It's now 9:15. Over the years, you might have struggled with an upper respiratory infection, but how do you know when you need to go see the doctor and when you just let your body take care of it? Well, we welcome back to the program Dr. Stacy Chronister, an internal medicine specialist with OSU Medicine, with some answers this morning. Good to see you.
Yes, thanks for having me back.
Well,
I'm happy to talk about this.
We are very excited. She has lots of topics over the coming months, but I thought that this was a lot of people right now, my husband included, having the drainage, having the cough, having all this stuff. So I guess kind of give us an overview of like what should people know?
Absolutely. I think that as Americans, we are the workhorses, right? And so it's inconvenient to be sick.
Right.
And I always like to reassure people, it is very normal to be sick. It's actually normal to get a bad cold up to about 5 times a year.
That sounds awful.
It sounds awful. Imagine if you had to be out today because you were sick.
Right.
But it's completely normal. We have sick days for a reason. So it's okay to take those, and it's okay to let your body rest.
Because that's what our body needs to do.
Yeah.
So now who's more likely?
Absolutely. I really worry about my allergy sufferers. So those people that are always itching their eyes, itching their nose, that creates this kind of warm, moist, boggy environment, and that's exactly where viruses and bacteria love to live. So if you are a chronic allergy sufferer, it's really important to keep those under control. You might need a daily allergy medication. You might need a daily nasal spray to help control that so that way you won't grow the bad bugs.
The gunk, right.
Yes.
Okay, and let's talk about antibiotics.
Yeah, so actually very few upper respiratory infections need an antibiotic, a very small percentage actually. But why does everyone feel better when they get that antibiotic? Everyone says, oh, I went to the doctor, I got that antibiotic, and I felt better.
And the next day I was better.
Actually, everyone says that, right? But really, those antibiotics that we use for upper respiratory infections oftentimes have anti-inflammatory benefits to them. So really, it's not even so much that they needed an antibiotic, they really just needed an anti-inflammatory. So we're going to talk about some few things they can do over the counter that can be more like taking around-the-clock anti-inflammatory to really kind of mimic what the benefits that they think they're getting from that antibiotic.
Yeah, we'll get to that recipe in just a moment. And it's really simple. I'm going to make sure that I have it at home because these are things that you can get over the counter and have available when you start to have some of those symptoms. But let's talk a little bit about the symptoms. At what point should you say, yeah, this is dangerous and I do need to see the doc?
Yes. Well, certainly, especially in the world we're living in right now, if you're experiencing something that's different than what you've had in the past and something is concerning to you, then absolutely reach out to your physician. But the main things that we think about are someone who has been suffering from an illness for more than 7 days, someone who has consistently had a fever that's spiking above 100.4, and someone who is having only symptoms in one area. So you know when we think that we have sinusitis, we're like, oh, my whole head hurts. This is that person that you go, right here, it hurts right here. That's actually more likely to be a bacteria than it is to when you are inflamed all over.
Okay, let's come back on camera because I want you to point those things out again.
Absolutely. So instead of saying, oh, my whole head hurts when I bend down, it's that person who says right here.
Okay.
It hurts above this tooth. That's when I'd be concerned that there's a bacterial infection. Bacterial infections usually are only on one side. They don't infect the
whole area.
all of the sinuses. That's more likely to be just really bad allergies or likely a virus causing all that inflammation.
Good to know. Now, see, I've always used as a mother, if it's clear fluid, it's not infection.
Yeah.
Okay, so is that still?
So the answer is, I love where you're going with this, and yes.
Okay.
But what we're talking about that looks bad is actually that stuff that, I hate to say this word, but pus. It kind of has that purulence to it, that like white
shine.
Color to it. Oftentimes people come in and they are like, it's green or it's dark. Well, mucus actually likes to change color the older that it is.
Really?
So actually, whenever people start having the green that they're coughing up or the brown, they'll come in and say, it looks worse. And I'm like, but do you feel better? Well, yeah, actually that's you kind of getting rid of that.
Okay.
So I wouldn't worry about those colors so much.
Sounds like an old wives' tale, a mother's tale.
We're definitely talking about gross things here, aren't we?
Well, that's part of it. But I think that's what is important right now because people are experiencing it and I want to help them be their own advocate. Okay, so this is so cool. Dr. Chronister has kind of this over-the-counter recipe, things to have available as you try to navigate.
Absolutely. Well, first off, no one drinks enough water, Leanne. I know you don't, I know I don't.
Right.
So increasing your intake by at least 4 cups a day is imperative.
Okay.
When you feel sick, you don't feel like drinking water, so it's okay to add a few splashes of Gatorade or something like
Propel,
that to
right.
it. Okay. Then Alka-Seltzer effervescent tablets, the old-fashioned plop plop fizz
Really?
fizz. That is the best stuff over the counter.
Okay.
Honestly, I think it's because people just have to drink so much water
With
along with it, as opposed to just pop a few pills, stick in their head under their faucet, getting a slurp, and moving on. I actually think that it's the whole formula that's a lot more effective. Afrin nasal spray. This is a little controversial, but because it can be a little dependent.
Addictive?
A little addictive, yeah. But I say twice a day for just 3 days.
Okay.
After 3 days, stop using it. But you feel better when you can breathe.
Sure.
You know, and you can't sleep when you can't breathe. So if we can get you breathing, the better you're gonna feel. About 30 to 60 minutes after you do that Afrin spray, I promise you're gonna have this like aha moment where you go, oh my gosh, I can breathe. Right then, I want you to go blow your nose, get all that junk out of there. And if you're capable of doing this, I know a lot of people do not like it, but if at that point you can go get the sinus rinses
Right.
and really flush that out, that is what is going to really get you over this a whole lot faster.
Love it. All right. We will have Dr. Chronister on back next month with another topic. Great to see you.
Thank you.